let's watch a combined cataract and glaucoma case. These combined cases are becoming more frequent in our population and across the world as we're learning the benefits of being able to take care of both problems with one trip to the operating room. Patients are getting better outcomes and a more efficient healthcare system when we learn to combine our techniques and strategies. So we're going to start out here with the most important part of any cataract surgery. That's the capsula rhexis. We want that to be perfectly circular and centered over the cataract. And then over in the top right, you're seeing an animation of the drainage system of the eye. This is one of the fundamental problems of glaucoma. The drainage system can collapse, and it's harder for fluid to drain out of the eye, and that leads to higher pressures. Higher pressures can damage the optic nerve and damage your vision over time. And so we're going to use a special device to address this problem. It's called an omni-surgical device. You can see it there in the handpiece. And what this device is going to do is this catheter will advance through that drainage system to open it up and break any adhesions. And then as we withdraw the catheter, it will deposit gel inside of that channel to stent it open so that the patient can have a better outflow or better drainage system. Once we've done that, we can actually go back and recannulate that same system a second time. You'll see the catheter advance the second time in this animation. And as we withdraw the handpiece this time, you'll see that we're making a cut in the roof or the top part of that drainage system. And that's going to let even more fluid drain out of the eye. And so in just a couple of minutes, we can lower patients' pressures, protect them from glaucoma, and reduce their chance of losing their vision over time. Then we just turn the patient's head back into position for the cataract surgery, and we'll speed this up here to get through it. And so for this part, you'll see just how cloudy and opaque that lens is, and as we take it out, you'll start to see it clear up piece by piece. So we break it into little bitty pieces, and then we start taking these quadrants out with this ultrasound handpiece, and it's a pretty efficient surgery. So in just 8 minutes, we've taken care of glaucoma and cataracts. And this patient is going to come back and see us on day one. She had 20/20 vision. Her pressure was 12, which is a really great reduction, and she had absolutely no pain. So she was thrilled with her outcome, and so am I. So now we're going to clear up these last few bits of the cataract, and as you can see, we just have nothing left but this beautiful red reflex where everything is really nice and clear. Once we've done this step, the next thing to do is put in some gel, and then we'll put in the patient's new lens implant. She's going to get an enhanced monofocal lens implant that's going to give her really great distance vision. It'll also give her just a little bit of intermediate, like computer and car dashboard vision. She'll still need reading glasses, but the quality of vision is pretty hard to beat. And so she is just thrilled with how she's seeing so far. These lenses do have a tendency to stick, so you'll see I kind of manipulate it there to get it to open up. And once it unfolds, it takes up a really nice position inside the eye, and it's going to last the rest of her lifetime. And she'll never have to worry about the cataracts again, and we'll continue to watch her glaucoma. But it's always nice when we can combine our skills and do a good thing for the patient in such a short time. It's really gratifying. It's a great part of my job. Hope you enjoyed watching this case.